Hey, Dr. Terry Scarborough here to talk to you about the gastric bypass. So these days we often do the sleeve, more often than the bypass actually, because it tends to have fewer issues, but there are indications for the gastric bypass and things that make the gastric bypass a better operation than the sleeve in certain cases. So first of all, let me just go through the diagram of the gastric bypass. So first of all, we use 5 pretty small incisions to do the gastric bypass. It's all laparoscopic, of course. And we make a small pouch right here at the top of the stomach. We divide the intestine down here and we bring it up and connect it to the pouch. And then we connect the intestine to itself down there. So when the food comes down, it fills up the pouch very quickly and goes down the intestine that way. So we bypass the stomach here. That's why they call it a gastric bypass. So patients that are particularly suited for the bypass are people that have really bad reflux, because once we make the pouch, you can't reflux acid in your esophagus anymore. And then people that have pretty bad diabetes. The gastric bypass tends to work better for people with diabetes that require insulin, although the sleeve works pretty well for that too. And then the last category of patients are people that just have more faith in the bypass. Maybe they had a family member that had a gastric bypass and that worked really well for them. Okay, so let's talk about the risks and benefits of the gastric bypass. Talk about the risks first. So the main risk of the gastric bypass is leakage from the pouch, which can happen within 2 weeks of the surgery. So you can get a leak in your staple line or the suture line here. But fortunately, it's quite rare. It's maybe one in a couple of hundred people or so. And when that happens, we have ways to fix that. And so it's rarely a major issue. Another risk, more longer term, is because of the rearrangement of the intestine, you can get blockages of the intestine, but again, that's pretty rare. It's about maybe 2 out of 100 or so people. And the third risk I would mention is sometimes people can get an ulcer right here, and that happens when people smoke or they take medicines like ibuprofen or aspirin, because that causes an ulcer of the gastric pouch. The benefits, though, of the bypass are people lose about 60, sometimes 70% of their excess weight. So if they're 100 pounds overweight, they can expect to lose about 60 to 70 pounds. And if you compare that to the gastric sleeve, it's a little bit better than the sleeve, about 10% or so better. Anyway, that's the gastric bypass in a nutshell. And thanks for listening.